Good morning. Thank you for allowing us to come here to share our experiences in working with individuals and navigating them within our hospital center here in Ward 8, Washington, D.C. Today, I just wanted to discuss two cases that have allowed me to recognize the importance of patient navigation services for the patients in this area, and as well as information I think that will be most important for those individuals in the medical field to know. The first example I would like to illustrate is the need for advocacy and support of our patients. The first case I would like to discuss is a patient, 50-year-old African American female, presented herself to the care center in Washington, D.C. With a history of substance use abuse as well as mental illness. She presented as being underweight. She was frail, depressed, and very confused. She began attending the care center's group sessions that we had going on at the time. And in the very first session that she attended, she indicated that she had a plan to kill herself. She also indicated that she wanted to do it quite soon, and she indicated the frequency in which these thoughts presented themselves to her. As a result, the navigation team, Ms. Hudson and I, we did speak with the patient at that moment just to sit down with her to get some more information, to do a little bit more exploring. And because we were actually situated in the United Medical Center hospital itself, it presented to be a very good place that we were able to walk her directly to the ER and have her linked directly to emergency services, after which she was directly taken to our psychiatric unit for approximately 7 days, I believe. After being a part of the psychiatric unit for approximately 7 days or so, she was released. We were able to meet with her. At that time, I believe she may have begun to develop some issues at home. She was coming into our center, meeting with us, but then she began to have some issues with paying different bills, paying her rent, and things like that. And I think ultimately because of her substance use, she was in the there was a possibility that she was going to be evicted from her home. So we began to work with her and try to find different resources in the area to assist her with those her housing situation, as well as the other situations that she may have experienced at that time. And again, the substance use that she had experienced was significant for her, and it really impacted her ability to maintain her ability to be adherent to the medication regimen that she was on at that time. As a result, we spoke with her and we wanted to link her to a local treatment program in the area. She, at that moment, was somewhat reluctant, but by us working with her directly, we were able to talk to her to get her admitted into, I believe, APRA, which is the Addiction, I'm, I'm sorry, Prevention Recovery Administration here in DC. We worked with her to get connected to that location. We actually picked her up from her home. We drove her over there to that location and sat with her until they actually took her in and gave her the intake process and took her to a location in which she would be settled for her treatment program. After being, I believe, in treatment for so many months, she later came back to visit us, and a completely new, different person. She had gained weight at that time. She had new glasses. She had new dentures. She had a new wig, and a completely different turnaround for this individual, considering how she presented herself in the beginning of when we first met her. So she stayed in the program for some time. So the lesson learned from that particular case was the need for advocacy and support of our patients. It is important to realize that even though they come in for medical care, there may be some additional things going on in their lives that may present themselves as barriers for them. And luckily, again, Ms. Hudson and I worked together closely with this patient and assisted her with these outside things in order to assist her to move forward with her medical care. The second case, briefly, had to do with working with an individual who basically presented himself as a 45-year-old African American male to the care center. He actually was diagnosed with diabetes and he was taking a number of medications. However, in speaking with him, the navigation team realized that he was actually taking medication for high blood pressure issues, hypertension, which he did not know. He knew he was taking a lot of medications, but he thought they were all for diabetes. After meeting with him, we found out again that it was for hypertension, and this was information that the patient was not aware of. So the other issue was basically that it's important for individuals to have some type of documentation presented to them from their doctor's office. That would be helpful, whether it be a pamphlet or maybe even a referral to a local counseling center or even a website. So that way the patient would be aware of what their diagnosis is, as well as information on the medication that they're taking.
Add one thing. You probably are thinking, wow, this is really labor intensive. This takes a lot of time and energy. We're still a pretty small operation, and if we had 1,000 patients, we probably could not provide this level of individualized care. But I think what's important is that we need to talk about where the resources can come from to provide this level of care for the people that need it, for the 1%. If it is 100 patients, how do we deliver this kind of care to those 100 patients so that we can see a decrease in healthcare expenditures? So thank you for listening to us.
Thank you very much. And after these glimpses into what I call the real world, we're going to have table discussions. You have 10 minutes to talk about, given what you heard, how would you educate health professionals in order to develop some of the qualities and skills we've been talking about? And the format for the report backs is not going to be every table has to say something. I'm going to call on whoever wants to report back on what you've learned from your table, and if somebody else already said it, then we won't need to hear it a second time. So 10 minutes, start.